welcome to this session, everybody. My name is Jill from WALX, and we've already done some housekeeping, but basically I'm going to introduce you to our guest speaker, and we are going to go through a block of sessions regarding cancer and exercise. So starting with what is cancer, then looking at prevention and the role exercise plays in that, and then we'll go into more specifics about exercise with cancer going through treatment. So Jason, can you hear me and can you speak?
I can, yeah. Hopefully you can hear me as well.
Yes, welcome to WALX. This is your first time as an expert, but it's not your first time as with us and the team here at WALX Nordic Walking UK, as it was when we worked together many years ago.
That's right, yes. So it's been quite a while now. But yes, so done a lot of work obviously with yourself and Martin in the past.
Yeah, I think it was 2010, 2011 that you were an instructor first, and then you became one of our tutors, and then you became one of our exercise referral tutors, and then your career took off in an exercise referral direction. So do you just want to tell everyone a little bit about that and you know, sort of where you've been since then?
Yeah, certainly, yes. So I guess probably best if I start sort of right at the beginning. So I started off in the fitness industry as a gym instructor. Um, got involved in an exercise referral scheme at the first gym that I worked at and really enjoyed that side around working with people with a range of long-term conditions. What was quite strange was that a lot of my own exercise I'd much rather be doing outdoors. So I used to do a lot of running, used to do a lot of strength training in outdoor environments and things as well. And yet when I was working with clients, it was very much around getting them into a gym, getting them exercising indoors. And so Nordic walking really was the perfect way of sort of practicing what I preach, really. So to be able to get people exercising outdoors for the health benefits of that, rather than gym-based exercise. So obviously you did, like I say, worked obviously with yourselves, and at that time we were doing the exercise referral through Nordic Walking UK as a instructor training course, and then I ended up actually running a citywide exercise referral scheme for the local authority. As part of that work, I started a cancer exercise pathway. So within that work, that was my sort of first interest really, and first sort of working with people who had a cancer diagnosis, as part of that work as well. Subsequently left that role and I went to work for Cancer Research UK. So I did a full-time job working mainly around sort of cancer prevention and earlier diagnosis of cancer. So a lot of that work was working with healthcare professionals, particularly in primary care, but also some of those links between GPs and people working in secondary care cancer services as well. So I did that work for about over 6 years. Currently working for a mental health charity. I still do some delivery of some cancer exercise sessions, and I'm starting to do a lot more on the delivery side of things again now as well. I've actually dropped my hours down to 3 days a week in my sort of main job, and just really excited to be getting back into some more of the practical side of things.
Brilliant. And so I think it's really easy. Obviously everybody knows the word cancer, but I do think sometimes we just say, oh, cancer, and it's that scary word. And so one of the things you wanted to start on is, well, what is it? So are you going to show some slides at this
Right,
time?
yeah. So like I said, I just had a few technical issues to start off with, so I'm just hoping I should be able to share my screen. I'll just see.
You should be now. You are co-host, so I've done all that. So
Let's have a look. Ah, yeah, it has come up now. Yeah.
yeah, fantastic.
Okay, so yeah, I think what decided it'd be useful to talk a little bit about what cancer is. That I think everyone's heard of cancer. Most people have had some sort of personal experience. My sister died of cancer when she was 40. It's something that affects so many people. And we know that for people that are born after 1965, about 1 in 2 people will experience a cancer diagnosis themselves at some point within their lifetime. So hugely, hugely prevalent. When we talk about cancer, what we're really talking about is cancers. There's over 200 different types of cancer. The main reason for that is that there's over 200 different types of cells within the body, and any of those types of cells can potentially become cancerous. So this slide's quite useful one just to sort of show difference between normal cells within the body and then as cells can start to become cancerous on there as well. So cells in the normal sort of process will divide, and there's that sort of constant regeneration process that's going on within the body, and that sort of normal process in any cell in the body. What can sometimes happen is that you can get mutations within those cells as they start to divide. Different reasons for that. Some of it can be just internal processes that are going on within those slides where things just go a little bit wrong, that it doesn't really divide in the way it's supposed to. There can also be external factors that make it more likely that you'll get mutations within those slides, within those cells as they divide as well. And that could be things like chemicals in tobacco, smoke, some of the other risk factors for cancers that we'll talk about as well. What also happens is normally the body's able to repair the damage that's caused as cells start to divide uncontrollably, but it can sometimes pick up pace and the mutations occur faster than the body's able to deal with them, and that's when it starts to develop into a cancer. People may have heard of different stages of cancer as well. So the stages be different for different types of cancers, but generally stage 1 and stage 2 cancers are what they class as early diagnosis cancers, those early stages. And that tends to be where the cancer cells are still within that original sort of part, so the tumour's not spread outside of the sort of the area where the cancer's been developing. And then stage 3 and 4 cancers are cancers where it's started to spread into other parts of the body usually, or it's starting to sort of protrude into other parts from the original sort of cells that have been affected on there. So when you hear about stage 1 and different stages of cancer, that's sort of really what's happening there as well. So just a really sort of simple overview of what cancer is. That links into the next part around prevention of cancers. A really important part on here as well is when I talk about cancer prevention, I'm very much talking about sort of population level. So we know that around about 4 out of 10 cancers are preventable. And so that means that if every single person in the UK no longer smoked, maintained a healthy weight, didn't eat sort of highly processed meats, all of the things that can potentially increase your risk of cancer, if people weren't doing that, around about 4 in 10 cancers would be prevented. At an individual level, we talk much more about risk reduction, so reduction of risk of cancer rather than prevention. So whatever you do, you can never be 100% sure that you're going to prevent cancer happening. And likewise, some people could be doing all the sort of the negative type health behaviours and still never get a cancer. So it's at an individual level, it's much more about risk reduction. And some of that is almost thinking about rolling a dice. So when we looked at how cancer develops and those mutations that happen in the cells that can cause cancer, so much of that is by chance. And yet what we can do with physical activity, as well as some of the other measures that can reduce cancer risk, is we can weight the dice in our favour. So the whole idea of sort of that healthy lifestyle, that way of exercising a bit more and things as well, it just helps to weight the dice in our favour to help reduce the risk of certain cancers. The other thing that's really important to point out as well is that 4 in 10 cancers being preventable is overall, so that's looking at all different cancer types, but the amount of preventable cancers differs very largely between different types. So, for example, things like skin cancer, quite a high percentage of those cancers are classed as preventable, whereas for some of the cancers, particularly some of the sort of childhood cancers, it's very much down to sort of internal changes that are going on, where something's going wrong in the cells, rather than any sort of external factor. So it does make a big difference in different types of cancer as well. Like I say, a person's risk of developing cancer is affected by a number of different things. Age is one of the biggest factors, and one of the reasons that the prevalence of cancer has increased so much over the past sort of 2 or 3 decades has tended to be, a lot of it is because people are just living longer. So a part of that is that as we get older, some of those processes, some of that regeneration, there's just more chance that things are going to start going a little bit wrong. So age is still one of the biggest factors around cancer as well. Genetics can play a part as well. So particularly for prostate cancer, for some specific types of breast cancer, genetics is a big part of risk for that as well. But then also exposure to specific risk factors, which we'll look at a little bit more on there as well. So, like I say, about 4 in 10 cancers, this is according to research by Cancer Research UK, and that equates to about 135,000 cases of cancer a year, so quite a considerable number of cancer cases, which are sort of estimated could be prevented if people adapted sort of various lifestyle changes. 4 of the most common cancers actually account for 2/3 of all preventable cancers as well. So lung cancer, around about 80% of lung cancers are classed as being preventable. A key thing with that is the vast majority of those are attributed to smoking, so to tobacco and the chemicals in that. There are a number, so that 15 to 20% of lung cancers that aren't attributed to smoking. There can be more to sort of internal factors as well for that, but the vast majority of lung cancer cases are attributed to smoking. Skin cancer, I think, is a really interesting one from an outdoor exercise perspective. That skin cancer is one of those cancers where there isn't any evidence to suggest that physical activity reduces your risk, but it is something when we're exercising outdoors or encouraging people to exercise outdoors that we need to be aware of in terms of that risk reduction. So making sure that people are wearing a high factor sun screen, you wearing a hat, you're walking and exercising in the shade where possible, wearing sort of long sleeved t-shirts, trousers rather than shorts, sometimes those sort of things. So you're reducing your risk of skin cancer is relevant very much for outdoor exercise for that as well. But then the other 2 cancers there, so bowel cancer and breast cancer, there is some strong evidence that physical activity can help reduce the risk of those 2 cancers. And then there's another sort of 6 cancers that are quite strongly linked to physical activity as a way of reducing those as well. As I sort of touched on there, smoking still the largest cause of cancer in the UK. Being overweight and obesity is the second biggest cause of cancer, and it's likely to overtake smoking at some point, probably within the next decade or so. Smoking is still by far the most harmful sort of factor, but it's to do with prevalence, that as smoking prevalence is starting to sort of drop quite considerably, levels of overweight and obesity are starting to increase, and so it's likely to be more cancers caused by obesity than there is by smoking at some point in the not too distant future. A little bit of talk about physical activity and reduced cancer risk. And I know Jill talked about some of the reasons for why physical activity can help reduce cancer, that type of thing. But sort of put hands up a little bit here and say we don't fully understand the reasons for that. We know that exercise can help with weight management, and so a really, really important reason for being physically active as well. But what studies have shown is, independently of people being overweight or obese, that physical activity can still reduce the risk of a smaller number of cancers. So breast cancer, bowel cancer, the main sort of two cancers, but there is increasing amount of evidence around bladder cancer, endometrial cancer, renal cancer, esophageal cancer as well. Some studies around stomach cancers as well as potentially similar. And the actual risk reduction tends to be around about 20%. So different studies have shown sort of slightly different amounts for that, but generally looking at around about a 20% risk reduction in cancer for people who exercise on a regular basis. In terms of amount of exercise, little variances between the different studies, but what they've tended to look at is comparing the least active, which they'll generally consider to people who are doing less than 30 minutes a week of at least moderate intensity aerobic activity, comparing to the most active, who would generally be classed as people who are achieving those chief medical officer guidelines, so doing at least 150 minutes a week, up to around 300 minutes a week of physical activity. So it's at those higher levels where people are getting that sort of level of risk reduction from that as well. Just want to say, is any sort of questions, anything to cover in terms of sort of prevention and reducing risk before we move on to looking at actual cancer diagnosis?
Just one, and I don't know that you'll have the stats on this one because it's obviously something quite new, but has anything come out regarding vaping? Was a great question that just came in, Jason.
Right, now it's a really good question, and I think it's one of those things where there was a lot around sort of e-cigarettes and vaping when I worked at Cancer Research UK, and I think it's very much the policy from Cancer Research UK is that vaping was a positive thing, e-cigarettes was a positive thing in terms of reducing cancer risk, in that the chemicals that increase the risk of cancer are very much the tobacco rather than nicotine. So nicotine itself isn't, there's no sort of real connection between nicotine and cancer risk. Having said that, I think there's emerging studies around other lung diseases and damage to the lungs that can be caused by some of the chemicals that are in e-cigarettes and things like that. And I think there's a huge thing around for someone who's already smoking, it's a much safer option to switch to e-cigarettes, to switch to vaping. Whereas the real issue is when people are starting vaping who haven't been smokers previously, where it's sort of a new generation of people that are sort of picking up that habit. But generally, the thinking is that it's tobacco smoke that is the factor that's linked to cancer.
Thanks for that.
Wider issues around vaping as well.
And another quick question: do you have the year of these stats, please? Somebody has asked.
Right, yeah. So the statistics around 4 in 10 cancers being preventable and the 135,000 people a year, that was 2015. That's a really big study. I think it may well be that there's some more statistics that come out in 2025. It tends to be around about every 10 years that Cancer Research UK commission a sort of quite a sizable review into preventable cancers. The figures on here, so those sort of 20% ones, that's a range of different dates for those. So relatively up to date. Some of them are a sort of meta-analysis where they've looked at a number of different studies, which will be from different ages, and you sort of brought together what the evidence is on those. So in terms of the risk reduction percentages, that's a variety of different sort of dates and things. But there is a lot more emerging evidence now for physical activity reducing the risk of some other cancers as well on that.
Brilliant. So shall we go on now to what do you think that's, the next little bit where you're looking at what you think is happening in the body when you exercise and why the thought is that is that where we're going next, Jason?
Yeah, absolutely, definitely, yes. And I think that's a really key thing as well. That it's as I sort of touched on at the start, it's not fully understood as to the reasons for that. For breast cancer, there's certainly a causative link between how exercise helps with insulin and estrogen levels, and that sort of relationship between sort of keeping those estrogen levels in check can have an effect on breast cancers that are linked to hormones. So that is a key part of it, really, for breast cancer. For bowel cancer, there's certainly a suggestion that when we're physically active, it helps with digestion and that sort of passage of stools through the bowels. And so that's potentially one of the areas that they think is responsible for that reduction in risk for bowel cancer as well. Quite an anecdotal one, but we've got a 14-year-old cockapoo who's quite reluctant to go out for walks now. But if she doesn't go out for that walk every morning, then she just starts to get a bit sort of having trouble with the bowel movements and things as well. So I think there is certainly something from that exercise point of view as to making sure that physical activity does help to sort of with that side of things. A lot of the other sort of parts of it, which you could potentially link to a lot of other cancers as well. And part of that is our immune system that I think sort of touched on earlier, that within our body, we've got defense mechanisms that sort of try to kill off those cancer cells. And so we have these like natural killer cells, NK cells, that are in the body to do that work. And we know that when people are physically active, it can help boost immune system. It can help with those sort of functions within the body as well. So it's more than likely that sort of immune response that we get from physical activity is part of that process for that risk reduction as well. And also inflammation. So we know that cancer is an inflammatory condition, and with physical activity, it initially raises inflammation in the body, but then drops it down to levels below the level of inflammation when we started exercising. So we know that exercise can be really beneficial in reducing inflammation in the body as well. And so potentially that is one of the factors as well that's linked to that reduction in cancer.
And when you say about the natural killer cells, as someone who's really into the Shinrin-yoku and forest bathing, is there anything being looked at in the UK wide, as there is in Japan, about the link between the I know there's a study in Japan with the cedar and pumping the cedar out, and that was supposed to increase natural killer cells. Do you see that somewhere, of the outdoor exercise being more beneficial to maybe indoor?
I've certainly not seen anything on that. I think you're definitely worth looking at that. I think there needs to be a lot more sort of research into some of those sort of other processes and things as well. I think that outdoor exercise can really help with stress reduction. And again, there's been a lot of sort of murmurings around if stress is linked to sort of cancer and things like that. There's nothing that's been sort of published to suggest that is the case, other than where if people are stressed, then they may adapt unhealthy. They might be more likely to smoke, more likely to drink sort of high levels of alcohol, that type of thing, less likely to be physically active. So I think there's an element of that outdoor exercise that can really help in terms of so many of those things. But I think it will be really interesting to see sort of more research on as well with some of that.
Brilliant. So we're moving now into you kind of, we want people to come in with some questions if you've got them, don't you, Jason? Because we now going to move into looking at the cancer during treatment.
Absolutely, yeah. So let's just start on that. So this is quite an interesting one. And what I always sort of point out as well on this is that exercise actually during treatment, so in that period of time where people are having regular chemotherapy sessions or radiotherapy or whatever, the treatment, surgery and things as well, to some extent, that it's very much a sort of a personal decision as to if and how someone exercises in that period of time. It's one of those things that it affects people in different ways. So people can go through exactly the same treatment and you have completely different effects from that treatment. So it is very much a sort of a personal decision. There is evidence that it can be beneficial, and within the NHS there is a lot more now in trying to support people and have conversations about physical activity during treatment as well. I suppose the key thing in terms of exercise during treatment is it so much depends on the type of treatment that people are undergoing for that as well. So if we talk about chemotherapy, one of the sort of real sort of big side effects that so many people experience with chemotherapy is that real sort of fatigue, particularly in sort of the days after treatment. And then depending on the cycles, people are just about starting to sort of get that reduction in fatigue, and it's starting again with the next sort of dose of chemotherapy. So there's been a number of studies that have shown that physical activity can help reduce fatigue, which it sounds a bit sort of counterintuitive, really. If you're sort of fatigued, you should do less. But what they're finding is that just by doing some gradual sort of paced exercise, we can actually help to manage fatigue. There's also been some studies that have just been in mice, which have shown that exercise actually improves chemotherapy uptake to cancerous cells as well. So some quite interesting studies around how the blood vessels sort of come together and how the uptake can be improved. But certainly in human studies as well, it's shown very much that there can be improved tolerance of chemotherapy. So people are being able to tolerate more sessions, potentially higher dose of chemotherapy to get the job done, which people who aren't exercising may have sort of lower doses, not as effective, or takes a longer period of time to get to that. So some of the key things around chemotherapy. Radiotherapy, if people are able to sort of find time to exercise during radiotherapy, still evidence that that is beneficial, just due to the nature of radiotherapy, that it's normally consecutive days of treatment over a period of weeks that the people having that. So it can be very challenging due to the frequency of treatment to actually have the time or feel able to do much during that time. But it's still beneficial where people are able to on there as well. Surgery, a little bit different, that generally the advice would be not to exercise until you've got clearance, which generally sort of 6 weeks, depends on the nature of the surgery for that as well. But normally that sort of period of time before you're cleared to start exercising can be really beneficial with any types of surgery in getting that movement back, getting the muscles to start working again, knitting everything together. That physical activity can be really beneficial, particularly sort of resistance exercises that are gradually increased, you're working on that area. But that's something normally working with a physiotherapist or within sort of cancer rehab schemes for that as well. There's been a lot more interest in cancer prehabilitation now. In York, where I am, there's a scheme that's just starting for patients that are waiting for lung cancer treatment to actually get them physically active before they start treatment. And part of the reason for that is that there's been so much evidence that people who are active before they start treatment have much faster recovery times and better outcomes. And even that could be sort of 2 to 3 weeks of exercise. It could be someone that was completely sedentary, just doing a very small amount over 2 to 3 weeks prior to that surgery, is getting better outcomes than someone that continued to be sedentary up until that point. The other therapy that's quite common within cancer treatments, particularly for prostate and breast cancers, where there's a link to hormones in terms of the growth of the tumours. People often put on hormone therapy. That's something that sort of comes partly as a beyond treatment as well as part of treatment, just because of the length of time with hormone therapy. So generally people are on those medications for 5 to 10 years. What those medications do is that they reduce levels of estrogen in the body, which is really important for reducing the risk of cancer recurrence. But the negative side of that is it can have a reduction in bone mass as well. So any sort of physical activity that can help to maintain or reduce the loss of bone mass is really, really important for that as well. And some evidence, and I think, I know there's a lot of this was at some of the conferences when I was working with Nordic Walking UK as well, around how physical activity can reduce joint pain that's linked to the hormone therapy. And there's some really interesting studies using Nordic walking that demonstrated quite a good reduction in joint pain. And in some people, that joint pain can be so severe that they actually stop the treatment because they can't tolerate the joint pain. So a really, really important sort of part as well where exercise comes in with that. Any questions before I sort of look at some of the considerations?
We have indeed, and it's from a lady I think you might know. It's from a Trish Cowie.
All right.
who used to work with you on the exercise referrals. So we are going back a bit here. Hi, Trish.
Okay.
Can patients do physical activity if they have a PICC line inserted?
Yes. So it is absolutely safe to exercise, but with certain considerations. So, and basically, there's other sort of ways of it's basically for people who don't know, for chemotherapy. Sometimes people are given like a line to give that sort of intravenous um, chemotherapy where they're not having to sort of put it into a different vein each time and all that side of things. So get like a central line, a PIC line. And the main sort of issues there is sort of around infection risk. And so you wouldn't be able to go swimming generally, anything like that. And certainly any sort of contact. So certainly contact sports would be out of the question. And also just being cautious of what you're doing, that you're not going to do something where it's going to get knocked, that type of thing as well. But it's not something that will be a no-no for physical activity. It's just certain precautions, certain considerations for that.
That's it on the questions. So
Okay.
carry
So
on.
that's fine. So the next sort of part of that is looking at some of those sort of considerations for exercise during treatment. One of the key things on there is around exercising to tolerance. So we talk a lot more about paced exercise rather than graded exercise. So a lot of the time within fitness, we have that approach where you're gradually increasing the amount that you're doing. So it might be for walking or running that you try to do an extra 10% each week in distance, something like that. During cancer treatment, it's doing what you feel able to do on that particular day, that you don't feel that it's going to be a gradual sort of increase each time. Sometimes people might be able to do a little bit more, other times they might do a bit less. So it's making sure that people sort of feel energized and not wiped out after exercise. And some of that is a little bit sort of trial and error. When I'm working with people, I always say that I'd rather that they did too little and feel fine the next day rather than do too much. So it's just getting that sort of right level for that as well. Um, in terms of frequency of exercise, and this is, I think, quite an interesting one when it comes to coming into sort of exercise classes and things at this point, is generally sort of 3 to 5 times a week. So a reasonable frequency of exercise, but it may be as little as sort of 10 to 30 minutes during that time. So for some people, 3 10-minute sessions of moderate aerobic activity a week, 30 minutes, it's classed as fairly inactive, but they're still going to get a lot of benefit from doing that amount of activity. And your 30 minutes might be the right amount for that person. As a maximum, if you're looking at sort of 5 times a week, 30 minutes, you're just about getting to that 150 minutes a week. That's the recommended sort of minimum for physical activity. So it's not being too concerned about having to do a certain amount. It's just you sort of doing those small chunks of activity as regular as possible. Shall I sort of cover a little bit about rate of perceived exertion and sort of effort levels and things as well on that?
Yeah, I think that'd be really interesting, and I think it's really important for those that are running the walking groups to factor this in, that quite often the sessions are an hour or the walks are an hour, and I know the guys that do a lot of the wellness, we certainly do it here in Dorset, is we have locations where we can kind of stop and then go on again with those that can. And I think from um, a class planning point of view, that is a really vital tool to have if you are going to invite people along who may just need that 10 to 30 minutes. Well, that's one lap of your park, and then they can go back and sit and have a coffee, and other people can do 2 or 3 more. So I think that's really important. So yeah, hit on the RPE as well, Jason, because I
Right,
think
yeah, that's
there's
fine.
a lot of people this could help.
That's fine. And I think one of the reasons just useful to mention that is I've actually used rate of perceived exertion between 11 and 14. So for people who haven't come across RPE or rate of perceived exertion before, it's basically a scale where you can sort of self-evaluate how hard you feel to be working. Quite often people would use a 1 to 10 scale. It's a little bit more simple to be able to understand. So if I say on a scale of 1 to 10, 1 is minimal effort, so you just really sort of stood up, not really doing anything. 10 is the most maximal effort you could ever sort of feel that you're doing. So if you sort of got the number 10 bus hurtling towards you and you're trying to get out of the way of it, that might be a 10. So a lot of the time we use that 1 to 10 scale just because it's more straightforward, really. Within clinical exercise, we often use a 6 to 20 scale, which can be a bit sort of confusing as to why we do that, but it basically helps us to relate it to heart rate a little bit more as well. So if you think that if someone's max, it depends a bit on age and things as well, but if someone's maximum heart rate is 200, then the maximum on that 6 to 20 scale is that 20. And then if you think that a typical resting heart rate might be 60 beats a minute, and so that's the 6, which is that lower sort of resting part of the 6 to 20 scale. So on an RPE of 100 and sort of 11 to 14, if someone is using a heart rate monitor, it's going to be, depending on age, somewhere just sort of 110 up to potentially 140. Might be more that 100 to 120 for sort of older age groups and things on there as well. But that's basically the level. So it is a fairly moderate level of intensity. So we're getting to that point where we can feel maybe our breathing got a little bit deeper, but we can still hold a conversation with someone. It's that sort of moderate level of physical activity. And we know that walking is likely to meet that. So that can be a really good sort of form of exercise for someone during treatment for that as well. Some people are able to work at a much more vigorous intensity during chemotherapy, but it is such a different individual thing. I've had people who have been very, very active before treatment and determined that even once they start chemotherapy, they're going to keep that sort of high exercise intensity going, and they're just completely wiped out and just not able to do anything. I've had other people who haven't been particularly active before and have just gradually built up the intensity of the training and found that they can actually work at quite a high intensity, even though that they're still undergoing chemo. So it does vary so much for different people as to that. But if someone does feel able to work at a more vigorous intensity, then it's fine for them to do that as long as they're not wiping themselves out. It's still that thing about feeling energized afterwards as well. And then the other thing I sort of touched on before is that you don't expect that sort of nice linear progression that people are gradually being able to do a little bit more. There's going to be some days where that drops down, a lot of days where they maybe can do a little bit more. So it's always having that paced approach and working out a way that works for that individual on there as well. Oops, go back up. There we go. Okay, so any questions before we move on from the during treatment?
No, we've had a couple of comments about what people do offering one-to-one, and I think you're going to touch on those sort of things later. So I think if there's nothing coming through regarding this, but you were going to look at some of the recovery and that kind of thing and specifics now. So did you want to go onto that now, Jason?
Yeah, definitely.
Bone health and that kind of thing.
And I think as well, it's sort of quite a key thing to point out as well that this is probably going to be more the time that people are looking at coming into a group, or you're sort of getting back to doing a bit more, or maybe starting something new for the exercise during treatment. It may be more that people just go out for a walk, unless it's someone that was part of a group beforehand and wants to just sort of keep those social connections, keep coming along and doing a bit of that. So it's generally after people have completed treatment that it may be that time where they start to think about doing a little bit more and doing some specific exercise for that as well. Lots and lots of benefits of exercise after treatment. So we know that for anyone, a cancer diagnosis is a huge emotional impact. And we know that from being physically active, particularly the outdoor exercise as well, being in nature, it can really help in terms of mood and psychological well-being. So it's really important of exercise as people are starting to do a little bit more after treatment as well. Can still help with reduced fatigue. So if fatigue can continue for a long period of time after treatment, again, just by building up the exercise that you're doing, it can help to reduce that amount of fatigue. Anytime when people have that sort of period in the life where they're not able to do as much activity, you get that deterioration in physical function as well. So we know that if we're not using our muscles, that we get that little bit of sort of atrophy, we get that wastage of muscles. If anyone's you had an arm or a leg in pot at all in the past, that 6 weeks of having it completely immobilized, you get a really significant amount of muscle wastage in that time. And you're not to the same extent, but if you're spending quite a lot of time in bed having treatments, you're not being able to do the things that you would usually do, you do start to get some of that same reduction in physical function, be it muscle, cardiovascular fitness, with that as well. Been a lot of evidence showing now that physical activity can help to reduce lymphedema risk, particularly in people who had a breast cancer diagnosis, and also if people have been diagnosed with lymphedema as a side effect of that, that there's reduced swelling and exacerbations of that as well. And again, lots and lots of studies that have looked at Nordic walking and the benefits of walking with poles, which has shown that it's safe to do for someone with lymphedema, and also it can be effective in reducing the impact of that as well. Some key considerations around wearing a compression sleeve and things like that, and certainly being aware of any swelling, and you sort of going back to healthcare professional if that was to happen. But generally, it can be really beneficial for that as well. Maintaining, improving bone health. Again, some of that can just be from people who have not been able to do the same amount of exercise that they would do if they weren't undergoing treatment, but we touched on with some hormone therapies how that can have a really significant effect on bone mineral density as well. And I'll touch on that a little bit more on the next slide. And improved sleep is a really, really sort of important part as well, of some of the benefits of physical activity. It does help us to have a better night's sleep, and we know if we're not getting that good night's sleep, that can have a really significant effect on our health as well. Okay, so I'll move on to looking at sort of bone health and particularly some of the exercises that we can do around that as well. So I think it's quite an interesting one in terms of people who are on hormone therapy. We know it's quite often people who haven't had a diagnosis of osteoporosis, but are at risk of developing that. So any sort of exercise, resistance exercise, where we're sort of loading those bones, is really, really important to do. One of the best things we can do is some form of impact exercise. The guidance is generally a ground reaction force of about 3 to 4 times body weight. So that's sort of a key thing to sort of be looking at if you are working with people, or if you're in that position where you're wanting to improve that sort of bone density, or to sort of reduce any reduction in that. Really, really important to point out, though, that if people do have bone fragility, so if they have had that diagnosis of osteoporosis, or in any cancers where there's been a spread of that cancer into sort of bones, particularly hip, spine, then the guidelines are different for that. So what I've got here is just sort of that general reduction of the risk of developing osteoporosis in people who are on hormone treatment. And we know in terms of aerobic exercise, it's far better to do something that's weight bearing. So for someone, going walking is going to be significantly better than going swimming or even riding a bike, because you're not getting that same sort of load bearing on those other two things. I think for Nordic walking, there's been some studies that have shown that using the poles, it does have a slight increase in ground reaction force from walking without poles. Not a massive amount, certainly not as much as you would get from running, but there is some increase in there. And also some of the main areas that are risk with low bone mineral density are the wrists, hips and spine. And if you think about walking with poles, you're getting that nice position, you're getting that loading through the wrist as well as you plant the poles into the ground. So really, really important exercise to be doing. With running, we do get an increase from what we would with walking in terms of ground reaction force. But if we're looking for that sort of 3 to 4 times body weight as the impact, then running's still not giving us enough for that. So the activity that I've highlighted in bold are ones that are sort of getting us between that 3 and 4%, sort of 3 and 4 times body weight. And again, it's sort of thinking within the exercise that you do yourself or within classes, it's looking at how you could potentially incorporate some of these as well. So even just sort of stepping up onto a 30 centimetre step, that's getting you round about a 3 times body weight ground reaction force. So something like that can be a really simple thing to be able to put into classes, and it's giving you that sort of benefit from that as well. Single leg hop, and about 3.4 ground reaction force. Lateral jump, so that just sort of jumping from one side, landing on the other foot, jumping back across. Yeah, sort of things where you can do it, lay the poles on the floor, have like a little bit of a course marked out and jumping across. Again, really beneficial. Quite a big range on that, depending on how much of a lateral jump people are doing there and the sort of the force on landing. And then things like star jumps, just over 4 as a ground reaction force. So hopefully that gives an idea of some of the things that can be really beneficial to do there for people
Does
maybe at
indeed.
risk.
Does indeed. And Jason, it's music to my ears, because all the ladies that laugh in the class and when I make them do hopscotch or, you know, some of the other mad things that we do in our total body walking classes, well, you've just justified it there. So
Right, yes, I think it's quite nice. That's I think we sort of talk a lot
they were.
about that people should be doing impact and things like that, but we don't
Yeah.
actually sort of quantify what the responses that you're getting from different exercises for that. So I can
They just
share
call
the
me
link to the
mad.
paper that comes from if that's of interest to people. But
Yeah,
um,
fantastic. That is, and Tracy's just confirmed that is a really useful slide. Not that we'll be nagging everybody, but when we tell them to do some bunny jumps, bunny hops, or some hopscotch in the future, at least we'll be able to say, well, look, go and have a look at that video on YouTube. Jason says you've got to do this. So
that's it,
thanks for
exactly.
that. Fantastic.
Okay, so what I'll do next, I'll just sort of move on a little bit around. Let me just put that slide in, just to sort of explain about some of the resources and things that are available around cancer. So moving medicine is a resource that's aimed at healthcare professionals. So if there are any healthcare professionals on this call that haven't come across moving medicine before, I'd strongly recommend sort of having a look. It's movingmedicine.ac.uk. And it's something that the Faculty of Sport and Exercise Medicine created to try and encourage more clinicians to feel confident talking about physical activity. So a lot of it is around those sort of clinician conversations that they have with patients. But what there is a number of different conditions on there, of which cancer is one of them. And within that, there's also like a patient handout fact sheet and things. So you can sort of look through that. Anyone can access it. It's not that you have to be a healthcare professional to sort of view the site. And there's a number under the consultation guides part of it. At the top there, there's a number of different conditions, and you can access a printout, sort of PDF of some of the key guidelines, which shows some of the benefits, some of the do's and don'ts for different exercise as well. And I think there is a real sort of push at the moment to sort of encourage healthcare professionals to have a much more guidelines-based approach. So you rather than a yes, you can be active, no, you can't, or things like that, to actually sort of give people more guidance in terms of what support's out there, where it is for most conditions, it's much safer to exercise than not to exercise. So there's a bit more of a push now in terms of getting clinicians to be more aware of having those conversations about physical activity as well. The other thing which I thought might be quite useful to have a look at in terms of considerations for people who have had a cancer diagnosis is that I think it's really difficult to sort of try and give an overview of of the considerations for cancer, because it's so different that, as we touched on before, there's a lot of different types of cancer. A lot of the considerations are based on the treatment that people have and the side effects that they've had from that treatment. So it is very much a sort of an individual thing. And certainly all the clients I work with, as a cancer exercise instructor, I'd always do an initial consultation with that person to go through all the medical history and the impact of the the cancer treatment that they've had and things like that before they join any of my groups. So I have like a sort of full 40-minute, half an hour consultation to sort of go through all those type of things first. What I thought would be useful from that sort of wider perspective is to just sort of pick out some of the things which would generally mean that people tend to be sort of lower risk for joining in with physical activity, and some other things to sort of watch out for, which would make it much sort of higher risk on there as well. So in terms of sort of the lower risk for coming into an exercise class, any sort of early stage cancers, so touched on at the beginning, that stage 1 and 2 cancers, where there hasn't been that sort of spread into other parts of the body. The earlier stage cancers, particularly early stage prostate cancer, early stage breast cancers, are generally considered quite low risk in terms of that sort of more general exercise. Particularly if people have been physically active before diagnosis, if people have got those higher baselines of physical activity, they know what feels normal for them, they know if something's not quite right. Whereas if someone's new to exercise, they may not necessarily know the difference between a little bit of muscle soreness and something that's not right following the surgery, that type of thing. So high baseline of physical activity can make a difference as well. They're also looking for no significant comorbidities. So by that, what I'm talking about is where people might also have diabetes or might have a heart condition, other considerations like that as well.
Jason, I'm going to stop you there because that's really it has prompted a question, and Dennis has said, can cancer treatments impact existing health conditions such as diabetes and glucose levels? And so that fits in with what you're saying about other comorbidities. So do you want to do that now, or do you want to do that after this slide?
No, we can have a look at that now. So it's basically, sorry, it's more around if cancer treatments impact on.
Does it impact on existing health conditions, or do the existing health conditions impact on the cancer treatment and so forth?
Right, yeah. So I guess probably the biggest sort of thing there is particularly for a condition like diabetes, where part of the management of the blood glucose levels may be through people having regular physical activity. So if someone's been able to sort of manage type 2 diabetes through physical activity and lifestyle, and then because of a cancer diagnosis and treatment, they're in a position where they have a huge reduction in the amount of physical activity that they're doing, then that can certainly have an impact on how well they're able to manage their blood glucose levels sort of during that period of time. So it may be that there's like a medical management side of it needed with the diabetes as well. And again, same with a lot of other conditions. So if things like high blood pressure, we know physical activity is really, really effective at managing that. So we can talk about helping us to manage high blood pressure, but also helping with not developing some of the cardiovascular conditions, risk factors, and things as well. Excuse me. But yeah, so it's more, I think, to do with that sort of almost like forced reduction in physical activity levels that can have an impact on other conditions.
Brilliant, thank you.
Okay. So yeah, so talks about comorbidity as well, and then the other point of it as well is what significant treatment side effects people have had, and again, it's so different that you speak to a lot of people who've had chemotherapy, and they may not have had any sort of ongoing effects after the treatment. There's other people where they may have conditions like neuropathy, peripheral neuropathy. So that sort of lack of sensation, that sort of damage to the blood vessels in the feet, in particular, from that. So it's really understanding if they have had side effects from the treatments, if they've had surgery, have they got full range of movement back now? Have they got any sort of ongoing complications, any sort of cording or anything like that? Have they got lymphedema? All those sort of questions really around that. But if the answer to those is no, then that would generally put someone as being sort of fairly low risk in terms of that sort of general exercise, as opposed to having that specific sort of cancer exercise type sessions as well.
Okay.
Some of the things that make it a little bit more, again, just more moderate risk, where it's sort of starting to think a little bit more around that is, as touched on there, peripheral neuropathy. If you think around from a total body walking and Nordic walking sort of perspective there, that if people have got less sensation of the ground underneath them, you can stand on a tree root and not realise that you're standing on a tree root. A changing surface might have much more of a falls risk as well. So it's that side of it, and foot care and things like that, that people may not necessarily know that they're developing a blister, or that they've stood on something, or they've got something in the shoe, and things like that. So there's a lot of additional considerations that come in if people have neuropathy. Can affect the hands as well. So again, you're looking at the sort of effect that has on gripping poles and various different things there as well, and knowing how tightly you're gripping with that as well. So that's a key one. As we touched on, with a number of treatments, it increases that risk of osteoporosis or osteopenia. And for people that haven't come across osteopenia before, it's basically a precursor to osteoporosis. So it's that early stage of osteoporosis on there as well. Again, you're looking at sort of falls risk, what exercise that we're doing with people to help to sort of reduce the risk of that as well. It's really, really important. If people are experiencing joint pain due to hormone treatment, again, just a little more of a consideration, even though we know that walking with poles can be really, really effective for helping people to manage that pain and to be able to continue to exercise on there as well. Particularly lung and any major abdominal surgery, and certainly if people have got a stoma of any description and things as well, that makes it use that sort of much more considerations around that, and certainly making sure that people are getting that guidance from someone. So in an ideal world, they would get that guidance from within healthcare professionals as part of that cancer team. It can be quite hit and miss. Some areas are very, very keen on physical activity within cancer pathways, and you try to make sure that there's lots of different contact points where physical activity is mentioned during that pathway. Other areas, I think people just sort of feel that it's something that's either not within their remit, or that they've got too many other things to talk to the patient about, and that physical activity isn't a priority, and things within that as well. But certainly at any sort of lung surgery, major abdominal surgery, it's making sure people have had that guidance, either from within that healthcare setting or from someone within the exercise world, who's got the cancer exercise qualifications on that as well. And also lymphedema, we've sort of touched on before, that there are considerations around making sure that people are wearing a compression sleeve, being aware of any increase in swelling, anything like that, and referring back in with that. So those are some of the things where it's generally still safe to exercise, but there's just more considerations and things around that. And then the final one, which is people where there's a much higher risk of exercise, and I'd say it certainly needs to be working with someone that's sort of more specialised in that area, and that's where people have unstable multiple bone metastasis. So where you're getting that spread into the bones, and it's having a sort of a compromising effect on the structure there as well, where people are at risk of spinal compression. Sometimes with some of the treatments or some of the cancers themselves, it can have more of an impact on our sort of cardiovascular risks. So some chemotherapy treatments increase the risk of people having some heart disease, and also some effects on the sort of the lungs and the way that our respiratory system works as well. Some people can be much more risk of blood clots, embolism. And these are sort of things where people would know that. It's not that someone will walk in not knowing these things, that people would generally start to be quite unwell with these sort of considerations. With a number of cancers, partly through treatment, also some specific cancers like a lot of head and neck cancers, some stomach cancers, you can end up with quite severe nutritional deficiencies as well, for various different reasons on that. And again, that would be a lot more sort of consideration in terms of the exercise approach there as well. People who've got a very high BMI, so a BMI of 40 or above, there's a lot more sort of complications that go with that as well. So again, that would be sort of more that high risk. And if people are experiencing extreme fatigue due to anemia, or breathlessness. Again, particularly linked to sort of lung cancers as well for that with the breathlessness. Again, that will be the higher risk thing. So we're not talking about it's quite debilitating fatigue sometimes that people get just through sort of standard sort of cancer treatment. But if people have got that really extreme fatigue, particularly linked to anemia, then that again would be a sort of higher risk on there as well.
Fantastic, thank you. That's been so helpful. We've had a couple of people who have had to leave because we're now into over the hour, but that's not a problem for anyone who wants to stay. We have got a question from Wendy J, and I hope she's still here. That is for anyone in later stages who has some energy, apart from helping psychological health mood, what else do you think it could benefit them by staying physically active, depending on obviously, you know, treatment and energy levels, etc.?
Yeah, so I think but all those things really, that fatigue can still be managed, depending if people are. So a lot of the time now, with those sort of later stage cancers, there's a lot of terminology that's used a lot nowadays around cancers that are treatable but not curable. So there can be people who are having chemotherapy treatment for sort of and surviving 10, 15 years plus. So there's a lot more sort of survivable cancers where there's that ongoing treatment with that as well. And again, it's still a lot around being able to sort of maintain the other aspects of health and fitness. So you to be able to keep active, to keep doing the things that the people want to be able to do. Can also help if people are still having chemotherapy in terms of the uptake and tolerance of that. So lots and lots of benefits around that, definitely. And I think, again, the psychological side is a really key part for that as well.
And what about at end stages beyond treatment? Would you still say to someone, stay active if you can?
It's very much a personal choice, is that. So I think it's for people to decide what's important to them, what they want to do with their time. So if someone enjoys a particular type of activity, or there's things that they really sort of get a lot of benefit from doing and feel that's what they want to do, then it's certainly encourage and support people in any way to be able to continue to do that. If someone feels that I don't like exercising, I've never wanted to exercise, then I certainly wouldn't be trying to encourage someone to do something that they're not wanting to do.
Okay, and then I think there's a lot of people now saying this has been really helpful, and thank you. One final question then, and we'll end on this if nothing else comes in. How important are the people supporting people as they go through cancer? So friends, family, when it comes to the exercise thing,
Yeah.
should they be encouraging, helping, but
Mm.
not, not pushing? What's your feeling there?
Yeah, now that is a great question, and I think it does make such a difference that I think even going back maybe sort of 20 years, that there tended to be a thing that if someone's undergoing cancer treatment or after cancer treatment, you should rest. That it's better you just sort of spend your time in bed. You shouldn't be doing anything. And I think some people will still have that belief. So even though there's a huge amount of evidence that saying that it's more beneficial to be active during treatment and certainly in the straight after treatment, there may still be family members that have got that, oh no, you shouldn't be doing anything, let me do that. So I think sometimes people can be sort of well-meaning but discourage people from doing activity. I think that's a key thing. I guess sometimes you can get it the other way around, where people are still expected to do all the cleaning, and you feel that if they don't do it, it won't get done. Where it would be that a family member could be more supportive by actually taking those things and doing it, and allowing the person that's undergoing treatment to really focus on what they get the most benefit from. So yeah, great question. And I think it can be sort of two different sides to that, definitely, in my experience.
Absolutely. Brilliant. Okay. Well, we've got some more thank yous coming in. So unless there are any other specific questions, obviously, if anybody feels that they want to ask any questions afterwards, if you email me, that's Jill with a G at walx.co.uk, I can pass them on to the relevant people. That includes instructors, sufferers, friends, family, whatever, going through treatment, not going through treatment. any questions. We do have some other support sessions. We've got Sam is running a breast cancer support group specifically. Jason and I will be back, I'm sure, on some other subjects. Our next expert webinar is going to be on January the 30th. We're not going to do December for obvious reasons, but on January the 30th, we're going to do exercise and diabetes, and I'm sure Jason will probably be joining us on that, because as we found today, there's lots of things that it's you know, people are people, and it's not ever just one thing. So any more questions? I can't see anything coming in, Jason. So from myself, that was really, really brilliant. You were so helpful and so informative, and it's been great to host you at WALX, and we'll be back again, I'm sure, doing something else quite soon.